afternoon and welcome to this DAO forum devoted to patients, led by professionals of the multidisciplinary team of the Clinical Institute of DAO. First of all, it's a pleasure for me to see how interesting this conference has been for everybody and how many people and how many patients we have in this forum. As speakers, in the first place, we've got Adriana Duelo, she's specialist in DAO Deficit. Adriana is a researcher, a pre-PhD researcher of the research group of Bioactive Amines in foods at the university. We also count on the participation of Judit Rigau. She's a dietitian. She studied at the University of Barcelona. Judit, specialist in clinical and sports nutrition. She's been working with the nutritionist team of the clinical hospital in Barcelona in cooperation with other medical centers in Barcelona. And currently, she works privately, specialized in DAO Deficit and also sports nutrition and clinical nutrition. We also have Claudia Gómez. She's a psychologist in the Nutrition Center. She's specialist in post-traumatic disorders and clinical pathology in adults by the University of Barcelona. This forum is led by professionals, and the reason for that is that the role of nutritionists is essential in the treatment of DAO because as it differs from allergy, the appearance of symptoms is not linked to the consumption of a precise kind of food that can be, but it can be associated to a very wide range of foods with different contents of histamine. And even you can have aspects after the consumption of products that maybe to start with, you might think they do not contain histamine. So this is a very difficult thing for patients when it comes to establishing a maximum threshold, which would be tolerable, and there is no clear consensus about this value. So for this patient who's suffering from these DAO deficit, it's very difficult to have these histamine-free diet because they are very restrictive diets that can end up having some not having some elements that we need. So that's why the support of a psychologist is essential as well. And with this brief introduction, I'm going to give the floor to Judit Rigau. She's going to tell us about how to follow this low histamine diet. Good afternoon and good morning to those of you who are listening to us on the other side of the world. First of all, can you hear me? Yes, okay. Okay, first of all, I would like to start this session with a very simple question, because if you're here today, if you're listening to me, it's probably because you have wondered yourself whether you have this DAO deficit or not. Maybe it sounds very strange. As a nutritionist, as a clinical nutritionist, I have to say that normally the patients that we have in our office, it's normally patients that have been reading, have been searching for, have gone through different circuit of different doctors, and they have ended up sitting before me. But if you're here today, I would like you to pay attention and I would like you to allow me to ask you whether you normally have a headache or if you have had or you normally have migraines. Do you have abdominal distension? Do you go to the bathroom, to the toilet normally, or maybe you're constipated, or the opposite? Do you feel that you have sometimes reflux? Does your skin itch, or do you have or have you had dermatitis or atopic skin? If you notice, as I go asking, you can observe that the symptoms are very varied and they are very different from each other. I continue. Do you normally have cramps or muscle pain? Do you feel the numbness of the hands and the feet? And how do you feel? Full of energy? Or do you have the feeling that you're always tired and, you know, dragging yourself? And finally, Do you normally have, are you congested? Do you normally sneeze? And have you had rhinitis? If you have answered to two or more symptoms, then it's very probable that you might have a DAO enzyme deficiency. But we're going to understand a little bit what this means. This DAO deficiency. As the number shows, the name shows, it's a deficiency in diamine oxidase. This DAO or diamine oxidase, as many other enzymes in the body, it's in the small bowel, and it's like a door for several nutrients to come in. So if the body doesn't produce enough DAO enzyme, or if these enzymes are not working properly, then what happens is that this histamine gets can be accumulated in the blood flow. So when DAO is not working properly, histamine is not metabolized, so it's not eliminated. So it gets accumulated in the blood flow. As a consequence of this, we have this array of symptoms that we have already mentioned before. So actually, the most common symptom because of these DAO deficiency is migraine, but it is not essential to suffer from migraine to have this DAO deficiency. The most important symptom is to have, the most important criteria is to have two or more symptoms at the same time. So we have said that with this DAO deficiency, this enzyme is not working properly. So this histamine accumulates, and that is what brings all those symptoms with it. But where does it come from? If we follow the line of thought that it's a digestive enzyme, the way in which this amine is accumulated is through the ingestion, the consumption of certain foods that have a high level of it. There are many foods that have this, but we're going to highlight three of them where there is a high level of histamine. The first is because you have consumed foods that have are off or contaminated. For example, meat, fish, they tend to accumulate histamine. That's the best known way of getting it. That would be histamine intoxication or poisoning. And we've had some cases here in Spain. The second group is foods that already contain histamine in a natural way in them. For example, spinach, aubergine, citrus fruits, tomato. And the third group would be by intaking fermented foods, for example, alcoholic beverages, cheese, etc. Why is it different from an allergy? DAO deficiency doesn't make it easy to relate the intake of a certain food to the symptoms because it's accumulative. So if you suspect that you might have this DAO deficiency, if you follow the requirements or you follow you're part of this criteria, what do you have to do? The diagnosis has to be done by the doctor or specialized nutritionist. Today in this forum, we're going to explain what tools you count on for this diagnosis to take place. And later on, Adriana will give you a brief summary of the evidence we have nowadays. Moving forward, well, once you have been tested, according to the results you get, we will apply one treatment or the other. But the basis for the treatment will be to follow a low histamine diet. The protocol comes at different stages. The first stage, in which we recommend you to follow it in a very strict way for a month. On the second phase, we add some modifications to the diet, and we work little by little with the progressive reintroduction of certain kinds of foods, and it will be different whether you're one patient or the other. So it's all individualized to avoid any kind of nutritional deficiency. As you can see, some of the high histamine foods that you can see on the screen are healthy. For example, salmon, tomato, avocado. We do not have to always relate the idea that if it's high, if it's histamine high, it will be unhealthy. No. And it's important to highlight this because, as you know, normally the first thing you do when you're suspecting to have this DAO deficiency and you start searching on the internet, when we search on the internet, normally we end up following diets which are too restrictive. Or, you know, you can follow this diet maybe for too long, and these might lead to a nutritional deficiency and these deficits that shouldn't be there. And this is something that wouldn't happen if you just followed a correct and an appropriate low histamine diet. So it's very important for you to talk to a specialized nutritionist that will adapt the diet to your needs. The other part of the treatment would be the use of the supplement, enzyme supplement before the meals. The posology would be different in each patient, and of course it's not essential, so that's why it's important to go visit a specialist so that he will adapt it. I would like to insist again that the kind of patient, our kind of patient would be someone who's got a lot of symptoms, so they do not maybe they do not connect everything together, and that means that they're going to feel lost. So they visit several specialists and doctors, and you know, they get tired, they don't know where to go, and they are lacking the energy needed. So what do I want to say? It's always necessary to have a multidisciplinary kind of work. In that way, you can deal with each factor that affects symptomatology. Among all of the professionals that we work together hand by hand, I would highlight the role of the allergologists, the digestive doctors, of course, but I think that nowadays the role of the psychologist is one of the most important ones because of the reasons that I mentioned before. We find in our offices someone, for example, a patient who feels lost or depressed. And that's why Claudia, who's one of the psychologists that works with us, will talk to you about the process of accompanying of the patients and how important it is to count on a good nutritional support in these cases. That's all I wanted to say. Thank you very much to all of you, and hopefully my presentation was helpful for all of you. Thank you. Thank you, Judit. We're going to give Claudia the floor. Yes, I'm going to share my presentation and then we start. Okay, thank you, Judit, for this presentation. Yes, I'm a psychologist, and I would like to talk to you about all of the aspects, emotional aspects that are involved in the these DAO deficiency before we reach a diagnosis and once a diagnosis has taken place. It's important to understand when we talk about the emotional aspects or the emotional impact of this disorder, this is a whole of the thoughts, emotions, normally negative emotions that we tend to feel when you are living with some kind of discomfort, chronic discomfort, or a very lengthy disorder. These usually affect our mental health because of all of those components that Judit was mentioning before. Before you feel disoriented, lost, you know, before you feel that it's a too long path or very tiring. This is what we know as emotional impact. I was saying, before we reach this diagnosis, before you go to the nutritionist office or the allergologist or the health professional, normally most of the patients have already undergone countless tests. You have visited many specialists. You have had a lot of, samples taken, analysis have been carried out. It's a very long way in which you're searching to know the answer, what's happening to me. In many cases, you do not reach the right diagnosis. So maybe you have a wrong diagnosis that become obstacles in the way, and the patient gets very tired before they get to this end of the DAO deficiency diagnosis. In this health route, there is a lack of understanding of the environment. Sometimes it's even the relatives of the patient, because they're doubting and they're saying, you know, this is not the right thing to do, or they're doubting about the symptoms. This generates a state of total frustration and sadness, because they're all symptoms that are real. So it is very frustrating, you know, that if you feel pain, if you feel this itching, you know, your closest environment should be very understanding, and sometimes they do not do that. Other times you generate the feeling of the lack of normality. That means that the majority of people can go to a restaurant, for example, or they can go out, have a drink with friends, because obviously when we reach a certain stage, if you have this DAO deficiency, mostly you know, people discover that fermented beverages, alcoholic beverages are not good for them, that they do not have a positive effect on them, and even if they do not have the diagnosis already yet. This brings with it certain fears, and these fears create the feeling, or bring about the feeling of vulnerability. You know, something strange is happening to me. It's something very wrong. Nobody knows what it is. It is not normal. So fear comes up. You're afraid of eating. You're afraid of drinking. You're afraid of going to a certain place. You're wondering what will happen if. So all of that is going to generate a process of deterioration, which is quite significant in the majority of patients that have not been lucky enough to actually reach the diagnosis in a shorter and more direct way. Once the specialists have found the diagnosis, sometimes this happens. This is the adaptive disorder. They present an exaggerated response after a very stressing agent. For example, the diagnosis of a disease. Normally, this disorder is transitory, it's not permanent, and it stays there for maybe the first 3 months after the diagnosis, and it doesn't usually go further from 6 to 9 months. What happens in this disorder? We have changes in behavior, a trend, the tendency to be socially isolated. You do not want to be in touch with your closest environment or your working environment. Some somatic complaints about the symptoms, you know, about how bad it's all been, about how painful it all is. Sometimes anxiety comes into play, or depression, and maybe small processes of, you know, this mourning, because you're leaving your health behind, right? And this grieving. In any process of adaptation to chronic disorder, discomfort, intolerance, difficulty that happens in a chronic way in time, there are several stages that I would like to tell you about, because maybe you can identify those stages, and it's important to understand that they're part of their normal part of the process of adaptation. The first one of them, the most common one, is negation. So the feeling of denial. This is not happening to me. I can't believe this is happening to me. It's something that I'm trying to search for people who are going to confirm professionally that it's not such a thing, that it's not happening. So the most common thing to say on this stage is this is not happening to me. Then we have the stage of the rebel. In this stage, the individual is showing more aggressive attitudes and rage sometimes. Sometimes you can even show this emotion against yourself, or you feel guilty. You need to know why this is happening. Why this is happening to me? What have I done? What has triggered this? And this usually generates a lot of rage. it is very important on this stage to offer the patient as much information as possible about the etiology of the disorder, about the origin of the disorder, you know, and it has to be information which has been professionally researched for, which is truthful. We find then we are on a stage which is the dissociation. This is the feeling of a strange feeling of, you know, before I could cope with anything, and now because of my disease, I cannot face anything. I cannot, you know, I had some plans for the future. They're not going to be able to be realized. I had some expectations that are not going to be fulfilled. So we start to be afraid that the disease will affect your life totally, or how it's going to affect you know, the reaching of all those goals and aims that you had planned for the future. Then we have the next stage, which is the stage of negotiation. I start to accept the new situation, but with some limitations or conditions regarding what the health professional is proposing, or the treatment. For example, they're proposing me to do this, X, right? And I'm going to start negotiating. So what do you think, nutritionist, a doctor, if instead of doing this, I could do this? Or if maybe instead of not eating this during a week, maybe I can do it for 3 days. That's a good sign, because it means that you're moving forward. And then we reach the stage of sadness or depression, which is the feeling of, you know, everything I have lost, everything I'm not going to be able to do. It's important for all the health professionals that working with patients to highlight very realistic aims that are going to be able to be reached. So we have to focus not on what we cannot do, but on what we can do, so that we can reach the stage of adaptation, or the stage of accepting this disorder. And then you say, I can continue living with this disorder, and it is not as limiting as I thought it would be, or as I thought it would be on previous stages. So then you're following the treatment guidelines, and then you can convince yourself that with certain kinds of with a certain kind of care, you can have a good quality of life. These stages do not have to follow one after the other. Yes, okay, there are some stages that do not take place. There is the absence of some stages, and some advice for health professionals that are going through some of these stages. Some advice would be to ask open questions to the patient. So these questions would be based more on emotions than their physical state. So these health professionals, doctors, we focus on the physical aspect of the people, but we forget about asking patients, what are you feeling? How are you feeling? And without further ado, I would like to thank you for paying attention to my presentation. And I'm going to give the floor to my colleague, Adriana. Thank you.
So Adriana, you can take the floor. Thank you. There I go. Can you see the slides? Well, my question, and it is not my question, but the question you, the patients, bring to us during the first consultation or the second one. Is there a cure for DAO deficiency? Of course, this is your main concern, and our answer is always the same. It depends. And what does it depend on? It's like the song, isn't it? It depends on the origin, the cause, the reason why you have DAO deficiency. In most cases, we have a genetic cause. In 80% of cases, there is DAO deficiency that has been caused by different malformations of identified polymorphisms. So can we cure DAO deficiency if we have some of these altered polymorphisms? And the answer is no, because You're born with your genetic load, and this cannot be modified. But we can talk about the quality of life. Can we have a better quality of life with an appropriate treatment once the DAO deficiency has been diagnosed? Yes, of course. And what's the important thing here? What does really matter? Well, it is to feel, the important thing is that patients feel well, and that's what we push during our consultations. There is a small percentage of patients with DAO deficiency whose condition has been caused by a secondary origin, secondary cause. We can find mainly a group of drugs that can inhibit and block this enzyme. Many years ago, papers have been published about this, and these should be reviewed because we are using 95 drugs that have been described as inhibitors, and some of them are better known than others, antibiotics, some mucolytics, antidepressants, also some anti-inflammatory drugs. So sometimes we can replace those drugs by other drugs, alternative drugs, but in other cases that is not the case. So in some cases, even if there is a secondary cause, well, if you really need that type of drug, then you will have to live with the DAO deficiency throughout your life. But again, as I said earlier, we can improve the symptoms with appropriate treatment. Another factor that will have a negative impact on DAO activity is our alcoholic beverages, because ethanol blocks the DAO pathway through histamine. And there are some specific beverage like cava, champagne, wine, and beer that have histamine in their composition. So they have a double negative impact on these patients. These are fermented alcoholic beverages. Then we have some digestive diseases like IBD, intestinal dysbiosis, hypermeability, where we can have a greater problem too. I can show you a video. We can see how histamine behaves in the guts. We've seen that intestinal dysbiosis and imbalance in microbiota could lead to an inflammation in the mucosa, and that would then lead to a DAO deficiency. So if we can fix this imbalance in microbiota or the hypermeability of the gut, we could also cure the DAO deficiency, as long as DAO is not being affected by a double pathway. If there's a genetic cause and then one of these four secondary factors that is also active. There are some cases also where surgical interventions take place and where ileum or duodenum are being resected, and if a part of the instantine of the guts where the DAO usually inhabits is resected, then of course we will have less DAO activity. So how can we measure the DAO deficiency? We have a DAO value that could be measured in blood. That was what we were using in the past, but this value is quite variable. And recently we're using 4 different genetic variables that can be tested through a PCR, to taking some tissue, well, some mucosa from the mouth, or using an injection. So that way we can identify those factors, and then we can know if the person has been born with a genetic load that would tend to suffering from the symptoms that are typical in DAO deficiency. As I mentioned earlier, the DAO inhabits in between the microvilli of the intestine. So this is where we can see that if there is an inflammation in that area, the DAO can be affected in terms of its activity. So it is here where we can have a DAO deficiency if there is an inflammation of the intestine. That is the case of this biopsies, which is quite often. There are many tests for the microbiota, and it is not easy to interpret this. So a nutritionist or a specialized doctor can prescribe this, but then you require that same professional to interpret the result. So here we have the video that I referred to earlier. This is a simulation of the DAO as if it were a jellyfish. It's waiting for the histamines to arrive. And we can see that some of them are captured as they should be, and some don't. So we see that these histamine molecules go into the blood flow, and they're going to travel throughout the body, and they're going to be accumulated in different tissues and being perceived by several receptors, and they are going to produce symptoms, and that's what we try to avoid. Here we have one of the the test results that you probably have. This is from 2016 when the DAO activity was measured in blood. Things have changed since, as I said earlier. This is not the only parameter that is taken into account in order to conclude and decide on a diagnosis. We heard earlier that you need at least 2 types of symptoms out of the ones she mentioned, my colleague mentioned earlier, but we also are looking for more objective parameters like the level of activity of DAO, and then also the genetic variables. That could be the perfect way to reach an appropriate diagnosis. And then the next step would be applying a treatment, and then if after 3 or 4 weeks of nutritional treatment, then we can conclude that the diagnosis is final. As I mentioned, the treatment will depend on the origin of the DAO deficiency, although in 99% of the cases, the basis will be a low histamine diet. And this diet with very few high histamine foods, also blocking, so not in taking any foods that block activity, and also reducing the foods that have other amines that can add to the impact of histamine, and then other foods that are the ones that free histamine or release histamine. So it is a very complex diet. And if you've tried that at home without a nutritionist, it's quite difficult, and particularly to have a well-balanced diet. So we always recommend that you see a professional, and also to use a DAO supplement is going to make your life easier. Your social life will be easier. Also, you can have a wider social experiences, and also the diet will be easier to follow. Instead of thinking about focusing our attention on the problem, we should try to focus on our daily lives and try to have it, organize it in an easy way, and always with a team of specialized health professionals. There are more and more nutritionists specialized in DAO deficiency, so you can find one close to where you live so that they will accompany you and that they can help you have a healthy and low histamine diet. Thank you very much. Thank you, Adriana. And also thank you to Claudia and Judit for their contributions. I have received many questions, over 50 questions, so we don't have sufficient time to answer them all. I have selected some of them. Some of them insist on the same aspects. One of the patients says, my mother has the DAO deficiency that has been diagnosed with migraine, and I have atopic skin. Could that be a hint to follow that I should also have the DAO deficiency? Yes, yes. Of course, we always require 2 or more symptoms to coincide, so you don't need to have the same symptom in both cases. Is it truly important to take the medication 20 minutes before? Yes, it is important because we need to give sufficient time to our stomach to bring the enzyme all the way to the small bowel. If we start eating just a few minutes before we take the DAO enzyme, we might neutralize the activity of the DAO enzyme too early. So it's better to wait a bit longer, about 30 minutes instead of 20, than taking the DAO enzyme just 3 minutes before you start eating. Thank you. Another question. If my genetic test is positive, but the blood test is normal, do I truly have a DAO deficiency? Yes, this is very interesting because, of course, there are many different tests. So if you have the clinical symptoms and you have a genetic test that is positive, that's sufficient to have a diagnosis. And the case we have, well, with DAO, and particularly in the case of women, we have the DAO levels fluctuating a lot throughout the cycle. So perhaps when that person went to have her blood taken for the analysis, perhaps there was a change. Just before menstruation, there is a peak in the DAO because there's a release of an endogenic DAO. So this could have an impact on the results. There could be some kind of factor that would bring the DAO levels up at that specific moment. Next question. Why most doctors prefer to analyze histamine throughout 24 hours instead of blood? Would it be a good thing to do both? Well, it's a very good question. Histamine in blood stays for a very short time. Its life is very short. In allergology departments and wards, they usually analyze histamine in urine throughout 24 hours. But this is not the only factor to take into account to come to a diagnosis. In order to have a high level of histamine in urine, you need to be eating histamine during the previous days. If the origin is genetic, should we have to take DAO enzyme throughout your life? I live in the Canary Islands. Will be discovered by the Social Security? Well, no, it doesn't need to be permanent, and you don't always need the same dosage. During the first stages of the diet, we have a more strict treatment, and we recommend to take the supplement every day But then each patient is different, and we need to adapt the treatment to the condition the patient has and his or her symptoms. It's true then when it's genetic DAO deficiency, this of course indicates that your body will not be able to manufacture sufficient DAO enzyme during your life. But of course, you will have to need that supplement, although not necessarily every day. And if you take the supplement, your symptoms will be reduced. Unfortunately, this is not covered by Social Security right now, but we do hope that in a few years' time, although I don't know when, this will be covered. Also, the blood analysis is not covered. Well, in some regions, it is covered, the blood work. Adriana, have you had any patients with all these symptoms, but with good DAO levels? What do you do then? Yes, when you talk about DAO levels, I suppose you're referring to, or also considering the genetic aspects. Well, so if I have a patient with symptoms, but all tests are negatives, well, we found that in consultations, and in that case, we talk to the patient and we try to improve their quality of life, and we start working with a diet. It's not damaging. It is a very good diet. It's an anti-inflammatory diet. And then we will do an assessment. If we see an improvement about after 3 or 4 weeks, then we will continue this treatment. Otherwise, if the patient, well, we are sure that they've been following the diet appropriately and there's no improvement, then we will need to consider other possible causes. What would be the groups of drugs that inhibit or block DAO and the DAO activity? Well, as I mentioned earlier, there are about 90 drugs that have been identified as DAO inhibitors, but this should be reviewed because the last revision was carried out about 10 years ago. But we see all sorts of drugs, antibiotics, mucolytics, antidepressants, analgesics. Anti-inflammatory drugs, all sorts of drugs. The list is published on our website. You can find it there. But don't really get too obsessed with that. Talk to your nutritionist and your doctor. We might find an alternative drug for you, or sometimes we can recommend intaking the drug together with a supplement, a DAO supplement. Next question also related to that. So if one of the symptoms is pain and many anti-inflammatory drugs are going to be inhibiting DAO activity, what drug should we take? Well, we are not doctors, so we may not recommend or prescribe any drugs. We can just say that you can send us an email and then we can recommend you a doctor who collaborates with us and who can answer your question. Two patients that live, one in Sweden and another one in the US, and they have symptoms that are related to DAO deficiency, and they would like to know how to do a test to try and have this diagnosis, and how can they have a consultation with the DAO Deficiency Institute remotely. Well, in Europe, it is quite easy to obtain the test or have the test done for the DAO activity levels in blood. I've had some patients coming from Germany, for example, and they had this test already in Germany. So you can ask to have this test done. I don't know if there are any genetic labs in the US who can do this, but in Europe, there are many who do so. And for the food follow-up, we can do everything online. We do this since the pandemic, so no problem to do that if you want us to help you. Also, we also offer many adaptations in terms of the diet and any sorts of adaptations that may be required for our patients, depending on where they live. Also, we hope there will soon be some specialized nutritionists that belonging to our institute in the US and also in Sweden. Judit, there's a question for you. There's a paper that where it is said that citrus fruits don't have histamine in their content. So if citric foods don't have this, why are they excluded? Nowadays, it's very difficult to determine the level of histamine contained in each food stuff, because in tables, food tables, we don't usually have this information. So we should be able to study each food, but then it will depend on when it is coming from. Also depending on the amount that has been analyzed. Also, I'm sorry that I'm interrupting, but the studies carried out by Sonia, to which the patient is referring to, they were precisely talking about the analysis of the histamine levels. But there are other amines in citrus fruits. So when we're talking about low histamine diet, we're not only talking about histamine or foods with histamine, but others with other amines too. So when we're drinking an orange juice, we are intaking putrescine. But if we are eating cheese, the histamine of the coming from the cheese is going to go directly to the blood flow, because the amine that we are intaking with an orange juice is competing with the histamine in terms of the DAO enzyme. We simplify things to make it easier for you to understand. Is there this kind, do you have these kind of diets for vegetarians or vegans? Well, the first answer would be yes, it's possible. We can have a low histamine diet that can also be vegan or vegetarian. But if the patient has digestive symptoms, for example, abdominal distension, constipation, diarrhea, or abdominal pain, reflux, when we are going to choose a vegan diet, well, our main source of proteins is legumes. And if the patient has bowel symptoms, then legumes would not be the best option for them. So we need to find an alternative with low fiber content that will be easier to be tolerated, like red lentils, for example. But instead of red lentils, we might need to use powder protein made of peas or other foods. So in terms of supplement, what is the enzyme that is used? Perhaps because the DAO supplement usually comes from pigs. Is this within the same question? In the case of vegan patients, There's a new option in the market, which is a DAO vegan DAO enzyme that is sold in Germany and Turkey, if I'm not wrong. Is that right, Anna? And we hope it will be sold in the other countries soon, because it is a very good option for this group of people who have vegan diets, and also perhaps for Muslims who don't eat pork. For Claudia, I think that my physical condition, because of my DAO deficiency, is having an impact in my work and my relationships. Could I have a depression caused by the pathology? Well, you can have depressive symptoms more than a depression itself. It is quite complex to explain because we often talk about depression, but one specific thing is to have a clinical disease, and then something different is to have a depressive symptoms. It's something different, but we can have this feeling of social isolation, not being able to be normal, not being able to eat like a normal person, and all these elements end up isolating you, and it may lead to you feeling depressed. I don't know what is the stage of the patient right now, but often when there's we are very concerned about something, we are sort of overwhelmed, and we are got an overload in our brain, and then it is sometimes difficult for us. So if we have high levels of concerns, then our attention level may be reduced. So the answer would be yes. Thank you, Claudia. So a question for the whole team. Is there a relationship between the menstrual cycle and histamine levels and DAO deficiency levels? Yes, of course. Would you like to answer, Judit? Well, during the cycle, during the first day or the days before menstruation and ovulation, there are several things that happen in all women. We are producing a release of histamine, endogenous histamine. This histamine release is produced because of the different levels of hormones, estrogenous and progesterone. So during the days before menstruation and during ovulation, we have a DAO. If we have a DAO deficiency, we will have a greater, we will accumulate more histamine and suffer more symptoms. So we often see in the consultation female patients who suffer from migraine, but they will say that with treatment they have improved, but they still suffer before the menstruation, because we have the food histamine, but also the histamine that is released by the person. And this leads to additional changes in the diet, perhaps have double dosage of the DAO enzyme during those days, or have a more limited diet during those days, or to try to limit some other factors that may be accumulating histamine.
Okay, so we move on to two more questions. Can dysbiosis worsen this DAO deficit? Yes, totally. It can do so totally, because as we said, DAO enzyme is an enzyme which is at the level of the intestinal wall. If there is some kind of alteration, like a growth of bacteria, and for example, colon bacteria would come up to the small bowel, then there is like this mixed salad of bacteria, and what that brings about, it's a gut inflammation. So if these membranes damage, it's damaging all of the enzymes that are working there. And that's how we have to treat both things at the same time. And as we're talking about this intestinal wall, how does gluten and lactose affect people with DAO deficiency? Yes. It's very much linked to what I said before. As in the small bowel, there are all of these digestive enzymes. It's common to have more than one intolerance at the same time, because if this wall is damaged, then more than one enzymes will be involved. So the direct intake of gluten is not what's bothering us, or it's not what's worsening the symptoms related to histamine. That's not how it works. It's much more focused on whether this intestinal wall is damaged. For example, if you're a celiac and you don't know, the intake of gluten, what is producing is that the other enzymes in the bowel, in the small bowel, are not working properly. So once we detect it and we get rid of this gluten, the intestinal wall comes back to normality. And when it comes back to normal, all of the symptoms are reduced. So normally we deal with more than one intolerance at the same time, but the reason or the way it's working, the way each intolerance works will be different, will be independent. Thank you, Judith. And we had many questions unanswered. Of course, I will send the questions to all of you, to Adriana Duelo's team, so that maybe you can answer here, or maybe in one of those Instagram lives. And or it's exceptional to see all of those communication ways of the team that are open, of course, for answers or any kind of doubts. Thank you very much to all participants. Of course, thank you to Adriana, Judith, and Claudia for your presentations and the information you gave us. It's all very enriching. Sorry. We'd like to thank you for being there day by day and for working with this community of patients, which is wider and wider. Thank you for this important work of changing the way of life of these patients that are suffering from this disorder that can limit life to a significant extent. We'll continue to generate clinical and scientific evidence, and we'll continue to help patients. Adriana, we trust that your team will grow and that you can be present in many parts of the world. Thank you very much. Yes, thank you. Thanks to the team and thanks to the organization. Thank you.